You went into hospital for a routine procedure. A nurse slid a needle into your arm. Within seconds, the world went dark. You felt nothing. You remembered nothing. You woke up hours later in a clean bed, stitched, monitored, and safe. Machines beeped quietly beside you. A doctor checked your vital signs. Painkillers dulled anything you might have felt. Antibiotics guarded against infection before it could even begin. 5,000 years ago, someone lay down on the ground and let another person cut into their skull. No needle, no anesthesia, no machines, no painkillers, no antibiotics, no hospital walls, no trained surgeon with years of medical school behind them. Just a sharp stone tool, a steady hand, and a person fully awake for every second of it. And somehow, they lived. Archaeologists in Turkey uncovered a skull dating back 5 millennia. Cut into the bone was a clean, deliberate hole. Not a wound from battle, not a fracture from a fall. A hole made on purpose, by another human being. The edges of that hole were smooth. They were rounded. They showed the unmistakable signs of healing. That single detail changes everything. It means the person did not die on the operating ground. They did not die in the days after. Bone does not heal like that in someone who is already dead. It takes weeks for bone to begin remodeling. It takes months, sometimes years, for it to heal as fully as this skull shows. Which means this ancient patient did not just survive the operation. They lived on for a long time afterward. They ate, they slept, they walked through their world again. They may have raised children, they may have grown old, all after undergoing one of the most dangerous procedures a human body can face, using nothing but the tools their community had on hand. This is not an isolated story. Skulls with this same kind of surgical hole have been found across the ancient world, in Europe, in South America, in Africa, in Asia. The procedure even has a name. Scientists call it trepanation. It is, by some estimates, one of the oldest known forms of surgery ever performed by human hands. And the evidence suggests it happened far more often, and far more successfully, than most people would ever guess. For a long time, historians assumed early humans understood almost nothing about the body. They pictured our ancestors as fearful, superstitious, guessing at cause and effect, with no real grasp of anatomy. This discovery challenges that picture directly. Someone had to know where to cut. Someone had to know how deep was too deep. Someone had to understand that cutting too far in one direction meant instant death, while a careful shallow cut in the right place could be survived. That is not guesswork. That is knowledge, tested and refined, passed down from person to person, likely over many generations. Consider what the operation itself would have looked like. A patient lying on packed earth or animal hide, firelight flickering nearby, or the harsh light of open day. Someone kneeling over them, gripping a sharpened stone tool. No mask, no gloves, no sterile tray of instruments, just flint, or obsidian, or another naturally sharp material, carefully shaped by hand into something fine enough to scrape through bone. The surgeon, if we can even call them that, would have needed to scrape slowly, layer by layer, removing bone in careful strokes rather than a single violent cut. One wrong movement could sever something vital beneath the skull. One moment of panic could end a life instantly, and the patient most likely was awake through the entire process. There is no evidence of anesthesia in this era. No plant compound strong enough to fully block pain like this has been confirmed at these sites, which means the person having this operation done to them felt it. All of it. The pressure, the scraping, the vibration of stone against bone traveling through their skull. And still, they did not move enough to cause a fatal slip. Still, they endured it long enough for the procedure to be completed. That alone tells us something remarkable about human will. But why would anyone choose this? Why would a community, thousands of years before medicine as we know it existed, decide that cutting into someone's head was worth the risk? There are several likely answers, and they may all be true at once, depending on the time and place. One reason is trauma. A blow to the head in this era could easily crack the skull. Fighting, falling from height, being struck by an animal, or an accident while hunting could all cause swelling beneath the bone. That swelling, if left alone, puts dangerous pressure on the brain. Ancient communities may have observed, across many cases over many years, that removing a piece of skull relieved that pressure. They may have seen that some patients who received this treatment survived, while others who did not, died. That kind of pattern recognition, repeated over generations, could easily lead to a working medical practice, even without anyone understanding the biology behind it. Another possible reason is seizures. Ancient people had no concept of electrical activity in the brain, but they could see the effects. A person collapsing suddenly, their body convulsing, foam at the mouth, total loss of control. To a community with no modern explanation, this must have looked terrifying, almost otherworldly. Some early cultures may have believed that opening the skull released whatever unseen force was causing the affliction, a spirit, a pressure, a sickness trapped inside the head with nowhere else to go. Whether or not the belief was medically accurate, the outcome for some patients may still have been genuine relief, especially in cases where physical pressure inside the skull truly was the cause. There is also a spiritual and ritual explanation that many researchers take seriously. In some ancient societies, the head was considered the seat of the soul, of thought, of identity itself. Opening it, under the right despite ritual conditions, may have been seen as a way to release suffering, illness, or even a malevolent presence believed to be trapped inside a person. This wasn't necessarily reckless superstition. It was an early, imperfect framework for understanding something ancient humans had no other way to explain. They lacked the language of modern medicine, so they built their own. Regardless of the exact belief behind any single operation, the physical skill required remained the same, and that skill did not appear by accident. Evidence from multiple trepanned skulls shows patients who survived not just one operation, but two, and in rare cases even three, separate procedures performed at different points in their life. Think about what that means. A person survived the first operation, they healed, and at some later point they returned, or were brought back, for another one. That is not a story of one lucky outcome. That is a story of a functioning, repeatable medical practice within a community, refined through trial, observation, and memory. Somewhere in that ancient world, there were people who understood, better than almost anyone else around them, how to perform this procedure with a real chance of success. They would have learned through experience, through watching an elder perform the operation, through their own early failures, which we will never know about, buried beside patients whose skulls never healed at all. Every skull we find with clear healing represents a success. But for every success, there were almost certainly others who did not survive. Deaths from infection, deaths from blood loss, deaths from a hand that slipped at the wrong moment. Those failures are largely invisible to us now, but they were not invisible to the people living through that era. Each survival would have been hard-won, built on losses that came before it. That is how the knowledge advanced, not through textbooks, not through formal training, through direct, brutal experience, carried forward by people determined to help others survive whatever was threatening them. Picture the person on the receiving end of this operation. They knew, almost certainly, what they were agreeing to. They understood the risk. There was no promise of success. There was no modern reassurance that this procedure had been done 1,000 times before with predictable results. And still, they chose to go through with it. Whether from unbearable pain, desperate hope, or trust in the person holding the blade, they made a choice that took extraordinary courage. Now picture the person performing the surgery. Their hand had to stay steady while another human being lay beneath them, conscious, in pain, possibly afraid. There was no anesthesia to keep the patient calm. There was no team of assistants to help if something went wrong. Just one person, entrusted with another person's life, working with tools shaped from stone. If they succeeded, they gained knowledge that could save the next patient too. If they failed, that knowledge may have been lost entirely, or passed on as a hard lesson about what to avoid next time. Every attempt, successful or not, shaped what came after it. This is how ancient medicine grew, slowly, painfully, through generations of people willing to try, to fail, to learn, and to try again. There was no printing press to record what worked. There was no formal system to pass instructions to the next town, the next tribe, the next generation. Knowledge like this traveled through memory, through demonstration, through the words of someone who had done it before, teaching someone who would one day do it themselves. And somehow, despite all of that fragility, it worked well enough, often enough, that healed skulls like the one found in Turkey exist for us to study today. This discovery forces a shift in how we think about the people who came before us. We tend to imagine ancient humans as primitive, as lacking any real understanding of their own bodies. But someone, 5,000 years ago, understood enough about the skull to cut into it, and to do so in a way that allowed the patient to survive and recover. That is not primitive thinking. That is careful, calculated, hard-earned skill. It came from watching, from remembering, from caring enough about another human life to risk everything trying to save it. There is something deeply human in that. Long before modern hospitals existed, long before anesthesia, long before we understood anything about infection or the brain, people were already trying to heal one another using whatever they had: a sharpened stone, a steady hand, a community willing to trust that hand with their life. The patient whose skull was found in Turkey lived long enough for that wound to fully heal. They walked away from an operation that, by any reasonable modern expectation, should have killed them, and they are not alone. Across the world, in different centuries, different cultures, different corners of human history, other people did the same. They lay down, they endured something almost unimaginable, and they got back up again. What survived alongside them was something just as important as the bone itself. Proof that human beings have always been trying to understand their own bodies. Proof that courage did not begin with modern medicine, but existed long before it, in people willing to face pain most of us will never have to imagine. Proof that even without a single modern tool, without a single modern drug, humans found a way to save one another. Today, we walk into a hospital and trust a system built on centuries of accumulated science. We are put to sleep. We feel nothing. We wake up expecting to recover. That expectation exists because of an unbroken chain of human effort stretching back further than most of us ever consider. Somewhere near the very start of that chain is a person lying on the ground in ancient Turkey, wide awake, feeling a stone blade cut into their skull, and somehow living to tell the story. We will never know their name. We will never know their voice, their fears, or what exactly they believed was happening to them in that moment. But their skull remained, healed, whole, and waiting thousands of years to tell us something modern medicine sometimes forgets. Survival has never only been about tools. It has always, first, been about will.